Welcome to my channel. I'm Dr. Andrea Ferrero, and today I'll talk to you about custom-made insoles, an extremely useful tool for various foot and lower limb problems, but they're often prescribed incorrectly. Please subscribe to the channel and like it if you think this video or the ones on my YouTube channel might be useful to you or others. Thank you. There are essentially two types of insoles on the market. Non-custom insoles, often made of materials like silicone, essentially serve only to cushion body weight by distributing it over a softer surface than the one found in your shoes. We also offer custom-made insoles, which are personalized orthopedic devices, meaning they're designed to fit your foot shape and your weight distribution. These are different from standard insoles, which are the same for everyone. Custom-made insoles are designed to meet specific needs. Since they're custom-made, they're also much more expensive than pre-made ones. So, a question immediately arises, are they worth the expense? There are some cases where they're actually useful, but there are many people who wear them without any rationale. In this video, I'll try to explain when I think they can be useful and when I think their cost isn't justified. To avoid taking something unnecessary, the prescription of insoles should be made by a doctor, based not only on the patient's medical history, such as general foot pain, but above all, with the support of a medical examination. During the medical examination, it is essential to examine the patient's standing and view the imprint of the foot on the podoscope, a transparent illuminated platform that allows us to assess the foot's support and thus distinguish between a normal foot and a flat foot and a high arch. Flat feet are those where the sole of the foot rests on an excessive surface, while high arches are those where the foot rests only on the heel and forefoot, but not along the central portion. There are people who go directly to orthopedic shops to buy insoles, where they may do an electronic gait test, which, however, I believe cannot replace a medical opinion. And of course, I say this without fear of controversy or criticism from those who instead believe in this method. Let's start right away with the most common reason for prescribing custom-made insoles, flat feet. What I'm going to say now applies only to adult patients and won't mention children, who deserve a separate discussion, which I hope to address soon in another dedicated video. Personally, I don't think all adults with flat feet really need them. A flat foot that doesn't cause pain isn't always indicated for insoles, but they can be helpful if the flat foot is associated with pain. We then need to understand whether the foot is truly flat or whether it is rather a structural problem of the heel, which is instead deviated into valgus, as you can see in the figure above, where the axis of the heel, outlined in red, is not aligned with the axis of the leg, outlined in yellow. In this case, I believe the insole is appropriate not so much for supporting the sole of the foot itself, but rather for realigning the heel with the axis of the leg. Restoring the heel's axis to the correct position significantly reduces the risk of the posterior tibial tendon becoming damaged or even ruptured over time, thus placing the patient at greater risk of requiring surgery to reconstruct it. The same applies to hindfoot varus, in which the heel tends to fall outward. In this case, it's equally important to realign the heel to avoid problems with the peroneal tendons, which run along the outside of the ankle and foot. Among the problems I believe can be treated with an insole is hallux rigidus, generally linked to osteoarthritis. In this case, the insole is often prescribed with a carbon fiber reinforcement under the big toe to try to reduce the dorsiflexion of the big toe, which typically occurs during the push-off phase of the step, which generally causes the most pain. Many patients benefit from insoles for mechanical overload, often manifested as calluses on the sole of the forefoot. These calluses, which can be more or less extensive, are often the result of overload, such as excessive tension in the calf muscles, for which stretching is always a good idea. They are also often the result of mechanical overload, such as excessive length of the central metatarsals, a topic I've dedicated a video to, which you can access via the link at the end of this presentation. Morton's neuroma can also benefit from insoles. This is essentially a swelling of one of the small nerves that run along the ball of the foot, which can cause pain and sometimes even electric shock-like sensations or reduced sensation. You can also find 2 dedicated videos on my YouTube channel. As I've already said, I believe more in clinical examination and assessment on a transparent platform called a podoscope than in electronic gait analysis methods. I have nothing particular against them, but to be clear, they are no substitute for a specialist visit. Before you even go to the doctor, let your doctor know if you tend to wear your shoes more in one area than others. During the examination, the doctor will see you walk without shoes or socks to assess whether your heel is properly aligned with the axis of your leg. It's also important to assess whether you have difficulty walking on tiptoe, as this could be a sign of posterior tibial tendon disease in the case of hindfoot valgus. The doctor will then evaluate the position of your foot under the podoscope to determine whether it is normal, flat, or high-arched. Your doctor will then examine you on the examination table, where he or she will assess whether your ankle is stable, whether there are any painful areas to palpation, whether your calf muscles are stiff, and whether your lower limbs are unequal in length. This last point is particularly important to evaluate because many people, even without any orthopedic issues, have unequal leg lengths, which over time can also cause knee, hip, or back pain. Generally, the area of the body that hurts is where the leg is slightly longer, but this is obviously not a hard and fast rule that applies to all cases. To accurately measure leg length, the doctor cannot simply place the ankles together to see if one malleolus is longer than the other. He or she must also assess the length of the leg, starting from the anterior superior iliac spine located in the pelvis, and then measure the length with a tape measure to the medial malleolus, or ankle. This is the only way to objectively and accurately assess any leg length discrepancies. Based on this information, the orthopedic technician can then attempt to equalize the length of the limbs by increasing the height of one insole compared to the other. During clinical examinations, I often encounter patients with slightly different leg lengths who come to me for knee pain, for example. In these cases, if the foot doesn't have any misalignment or misalignment, I often don't prescribe an insole. Instead, I suggest simply inserting an inexpensive insole into the shorter leg to even out the length of the legs. In this case, the insole doesn't need to be custom-made. You can easily find one at the supermarket for a much lower price. We now arrive at the point where the doctor deems an insole appropriate for your case. You will then receive a prescription specifying the type of insole to be made. You will take this prescription to an orthopedic clinic, where the orthopedic technician will take an impression of your foot and then craft the insole using various materials, all with the goal of distributing your body weight as evenly as possible, supporting the arch, relieving stress on overstressed areas, and improving the alignment of the foot and ankle. Initially, the insole is only temporary to give you time to try it for a few days to understand if any changes need to be made. Only then, when you find it more comfortable, will it be covered with the final material. Unfortunately, the insole won't fit all your shoes, so it might be helpful to bring the 3 or 4 pairs of shoes you wear most frequently when you book your insole, to see if the orthopedic technician can try to adapt them. In some cases, for a relatively low cost, you can also request a second pair of insoles so you don't have to swap them between shoes every time. Once you've removed the insole, you should expect an adaptation period of 3, sometimes 6 weeks. It's normal to initially feel a new sensation under the arch of your foot or elsewhere. This means the insole is working. Use it for a few hours at first, then gradually increase the amount of time you spend wearing it until you're wearing it all day. If you have persistent pain, simply return to the orthopedic technician for any minor adjustments. The insole works best when placed in a stable shoe with a suitable sole. Shoes that are too soft or worn out reduce its effectiveness. Don't compare the sensation to that of older insoles, as they may be different devices. When I prescribe insoles to correct a malalignment or to delay its worsening, hoping to avoid surgery, I always ask the patient to see me again a few days after receiving the insole. I believe it's important for the doctor to be able to assess whether the corrective insole is actually doing the job it was originally prescribed for. In particular, the cases in which I always want to see the patient are those to correct varus and valgus deformities of the hindfoot. As I explained earlier, as an example, I'm showing you this photograph in which the same patient before the insole, as you can see in the photo above, demonstrates a clear external rotation of the foot when viewed from behind, due to a slightly valgus heel. The same patient, this time with the insoles, as you can see in the photo below, demonstrates a marked reduction in external rotation in the right foot, indicating that the insole is effectively correcting the foot deformity, while the change is less significant in the left foot. In this case, but only for the insole on the left foot, I'm not completely satisfied with the correction achieved. If I feel that the insole is not adequately correcting the deformity, I ask the orthopedic technician to modify it according to my instructions. In short, custom-made insoles are an effective and personalized tool that helps reduce pain, improve support, and prevent overloading. The important thing is to use them correctly and give yourself time to get used to them. My advice is not to buy an insole as an attempt to alleviate foot pain, but rather to consider a clinical checkup with a foot and ankle specialist to determine if it's actually worth trying. Thank you very much for your attention, and I thank you even more if you will subscribe to the channel and share my videos if you think they can be useful to other people.